the work that I've been doing now, and this conference is a good example, after working in this area for 25 years, my doctoral dissertation was actually a holistic health program for schizophrenic patients done at a state hospital where I worked with patients for a period of 12 weeks. Along these lines, I had weekly groups that we called Growth Through Schizophrenia, where they would have permission, in fact be encouraged to talk about their experiences, and we would find parallels, or I would bring in things like the Native American Vision Quest, where people fast and also don't drink even water for 4 days. And that certainly brings about these kinds of experiences. Shamanic initiatory crises, which is a process by which shamans go through a period of breakdown, usually a mental breakdown, and then heal themselves, and then they become wounded healers, as they're called. And I would share these kinds of experiences and get the patients to talk about how their experiences were similar. But we also did things like daily jogging, exercise, art therapy, yoga. And what I'm finding is that work now is of much more general interest. At the time I was, when I finished my doctorate, I got a position at UCLA at a major research center for schizophrenia. But what I quickly saw is that they were so locked into the biomedical model that they really, I was given very concrete advice that if I wanted to do anything like get tenure, I would need to change these interests. So that's one of the things that actually pulled me into the transpersonal area. At the time that I did my doctoral dissertation in the late 70s, I was not involved, not really even aware of transpersonal psychology. And it's only later, as my interests started to get more defined and I began to see how alien they were to the mainstream, that I began to see that there was this other branch of psychology that took these experiences very seriously. Now, interests in spirituality and mental health in general, that interest has expanded, and there's many conferences all over the world occurring, which is very exciting. This one in Scotland is a great example of that. But there are annual conferences in England, and I know of a couple of other that are being cooked up in other places too. So I'm finding that this work is now kind of coming to some fruition, so I personally am being asked to write and present on this topic, even by organizations that have been very traditional in the past, like the American Psychological Association. I just finished writing a chapter for the American Psychological Association Press on transpersonal perspectives, transpersonal approaches, clinical approaches to psychosis.